Okay, hi everyone. Thanks for coming along to today's session. It's great to see so many of you here. So before we get started, I'm just going to do a couple of housekeeping checks. So if you can hear me okay, if you could just press the raise hand button at the bottom of your screen, that's great. Thank you guys, that's great. And I'm just going to lower those. And same again, if you can see the presentation and you can see our videos at the side, great. Brilliant, fantastic, thank you for that. So just to let you know, so if you want to, we've got teachers here today, so if you've got any questions about our courses or want to find out anything about studying at UVIC, to just press the Q&A button at the bottom of your screen and just type your questions in there, and you can just ask these throughout the session. We've got teachers here keeping an eye on that, so if you've got any questions, please use that to communicate with us. Yeah, and that's it from me. Just to say, this session is focused on careers. So we're going to be looking at different types of careers in medicine, dentistry, pharmacy, and going to do a sort of masterclass if we hopefully we'll get time to do that as well. If you want to find out more in-depth information about our courses, got lots of videos on our website from our previous open day. So if you go to the online open day page on our website, got lots of videos there for you to have a look at as well. So now I'm going to hand over to Karen, who's going to introduce today's session. Thanks, Karen.
Thank you very much, Laura. Welcome, everybody. So let me start with why study at UVIC? Well, UVIC is a large and diverse college with a wide range of courses. So we believe we have something for everybody. What we're really good at is adding value. So we can turn C's into B's, B's into A's, A's into A stars, and that's down to our teaching and learning. In terms of your development, you will be looking at you have access to a wide range of extracurricular activities. We have a sports academy. And I really believe that in UVIC, you can find your niche, whether you want to spend your time programming robots or baking cakes. There is a place for you in terms of your extracurricular activities. Okay. In terms of our entry requirements, you can see them on the screen there. So for science subjects, that was probably what you're interested in today if you're joining this presentation. You'll be looking at 6s for biology, chemistry, physics, or for double science, combined science if you're studying that. You're going to need a 7 to get into maths. These courses that we're discussing today, generally you're going to need A-levels to get into them. Entry via BTEC is extremely rare. Some of the universities do advertise that they will take BTEC students, but you've normally got to pass the UK CAT or the BMAT in order to get into medicine, for example. So they're really looking at A-level students. So some sort of examples where you might want to go. So if you took biology, chemistry, maths, that could lead you to clinical medicine, pre-clinical medicine. If you're looking more at nursing, you could get in, so maybe with psychology, biology, health and social care, so slightly lower qualifications. Medical technology is still up there with the A-levels. Pharmacy, again, chemistry is a requirement, as it is for medicine. And you can see that you've got the options with the chemistry, maths, biology type A-levels of the different types of pharmacy. Veterinarians, again, you're going to need absolutely need chemistry and biology to take you into any veterinary careers. And for dental practice, again, chemistry is a requirement, although you might think biology would be the requirement. It's chemistry that's the requirement there. Thank you. So I'm going to hand over to Dr. Jo Verfrets to talk about medicine in particular. Over to you, Jo.
Thank you very much, Karen. It's great to be here with you all today. I'm Jo. I'm the curriculum team lead for science, and I'm also a learning coach, which means I'm involved in supporting students that are going into medicine from 2 different angles. So what I'm going to do is I'm going to talk you through some of the routes that you might take into these different careers. So first of all, what are you going to learn during your medical degree? It's a very practical subject, okay? But first of all, you're going to spend a lot of time learning theory. It says a foundation level program. That's the foundation level program that needs A's and A stars. Okay, you need to be an absolute expert in the human system before you can start practicing on real patients. However, you do need to do there's going to be a lot of shadowing doctors, working in hospitals, a lot of practical stuff, and in labs as well. So there are hands-on experience in teaching labs in the university hospital, and you then progress to a field of your choice. So where's it going to take you after that? Well, there are 65 different medical specialism routes that you might choose to take after your medical degree. Some examples here: general surgery, obstetrics and gynecology, child and adolescent psychiatry, pediatrics, neonatal medicine. That's just naming just a few of those. And so what you're going to need to do, even before you go into medicine, but certainly during your time, is to look at individual routes to find out how many years it's going to take and also how much it might cost you. So A-level requirements, as Karen has just said, it is mostly A-level, and it is mostly 3 A's. A-level chemistry is essential, okay? I have to emphasize that you must take chemistry. Now, it's best to also do biology as well, because some universities also specialize biology. There are some that will take either one of biology, physics, and maths. Most applicants have 3 sciences. You would need to do some voluntary work. So you might work with with the general public. You're going to like shadow a doctor, volunteer in the hospital, or volunteer in a care home, something that shows that you're good with people. And the other thing you need is a satisfactory DBS check. That's showing you haven't got a criminal record. So you also need to get really high scores in these admissions tests. Okay, there's the UK CAT, which you need to register for between May and late September. Okay, and there's the BMAT, and that's got 2 test dates per year. We support students in those. We ask you to join our honours programme, and we provide support for students that want to do the UK CAT and the BMAT. Different medical schools use different ones, so it's best to take both, and you do need a high score in addition to your minimum of 3 A's at A-level, including biology and chemistry. Okay, so examples of typical offers for medicine. Well, I've gone for the top. We've got Oxford and Cambridge looking for A's and A stars. They want Oxford on A-level chemistry and 1 of biology, physics, maths. Cambridge, 2 A stars and an A. Look, A-level chemistry again. Okay, and they've said on their website that most applicants offer 3 science or maths A-levels. However, if you look around, you'll find that some universities take students with a little bit lower, so AAB, but that must include A-level chemistry and biology. So it's a good idea to have a really good look around. Now, there is also a graduate entry route. Okay, so that's for people who have attained at least a 2-1 in a degree that covers sufficient science. So, for example, some people do a broad biomedical science degree first, and then they move on into medicine afterwards. But that does mean an extra 3 years on the front of the medical degree. So that's an expensive way of doing it, and a much longer route as well. But it is possible to do it that way. So moving on to veterinary science, okay. That's 5 to 6 years at university, and that's the pathway to become a qualified veterinary surgeon. Entry requirements, this is actually more competitive in a way than medicine. They mostly want AAA, occasionally A star AA, has to be science subjects, although they do accept maths. Some unis accept 1 non-science subject, so again, look around. Now, there are widening participation courses, which will take students with the potential to be a vet, but lower A-level grades. So we're looking at something like maybe BCC at A-level for the University of Bristol. Okay, so that would be like a foundation, an extra year on the 5 to 6 years for foundation year, and you must have either biology or chemistry. It's incredibly competitive, and universities use screening questionnaires as well to test your knowledge of what it's like to be a vet and whether or not you're going to be suited to that. So where's that going to take you? Okay, it gives you the skills and understanding required to enter practice and any other area of veterinary work. Basically, you're going to be working as a doctor for animals. Now, there are two main areas that you might specialise in. You might work with domestic pets, so you might be the person that somebody takes their cat to or their rabbit to when they're sick. We have a lot of vets doing farm work, so they'll be working with much larger animals, stock animals such as cows, pigs. Now, horse riding is also very popular. So some vets actually specialise in equine, which is horse medicine. Okay, it's going to give you the scientific understanding you needed to enter many areas of veterinary work or biomedical science. You might also just enter some research in universities. There are career openings with government agencies, animal charities, and also pharmaceutical companies as well. And we've got dentistry on here as well. And I'm sure you all know what a dentist is. You've been to the dentist. Now, most people think it's just about teeth. It's actually a little bit wider than that. It's actually about diseases and disorders of the mouth. And it's about study, diagnosis, treatment, and prevention. Okay. So I'm sure you've all been to the dentist. What will you do? You end up working in a dental practice, carrying out straightforward checkups. Okay. You might be doing fillings, extractions, more complex procedures, root canal treatment, x-rays, administering anaesthetics. You usually have the help of a dental nurse who is a central part of this role. Now, what's different about being a dentist to being a vet or a doctor is that dentists generally keep office hours and they can also work part-time. Being a doctor, you do end up with some very, very long shifts. Veterinary science as well, you can get called out in the middle of the night, but generally with veterinary practice, you can work part-time, you keep office hours, but you do need very good people skills because a lot of people really hate going to the dentist and they get very, very stressed about it. So your people skills are essential. So what about your entry requirements? You need the UCAT, you need 3 A's A-level, you need to take biology and chemistry and get A's in both. You need to have done some shadowing of a dentist or just some evidence that you're good with people and you can work with the general public. Perhaps you volunteered in a care home, that might be enough. We do recognise, and the universities recognise, that because of the pandemic, it's really difficult for the students at the moment to get this volunteering, but hopefully things will improve and you will be able to do it. The other thing you need is a satisfactory DBS check. You need to have a clean criminal record. Okay, good. So finally, our last career on here is a pharmacist. And again, I'm sure you've all been to a pharmacy before to pick up some medicines. So what you're going to study on a pharmacy course is dispensing practice. You need to learn about the role of the pharmacist in the community. You need to study ethics of pharmacy practice, but you also need to be studying chemistry, body systems, and disease states. That's what you're going to do on your degree course. And where that's going to lead you, well, what people on a pharmacy course are hoping to do is to become a pharmacist. Okay. Now, pharmacists are experts in medicine in their own right, and they help people with minor health concerns. Okay, they can offer clinical advice. For example, you might go to them and say that you've got a minor illness, you've got a cough, a cold, a sore throat, tummy trouble, minor aches and pains. The other thing that pharmacists also do is administer vaccines such as flu jabs. So they are an essential part of the medical community. So entry requirements, typically high. Chemistry, again, is essential. Satisfactory DBS check. I've given some examples here of places you might go because there are quite a number of foundation courses in pharmacy. Okay, and I'm going to get you to the bottom bullet point of examples. You can do an MPharm, Master in Pharmacy, with a foundation year at Manchester, and that's CCC at A-level, including chemistry. And they will actually take DDD, DDM in BTEC Applied Science onto the foundation year in pharmacy. And we have had several of our Applied Science BTEC students take that route and go on to a foundation year in pharmacy and go on to become successful at that. But GCSE maths and English must be a grade 5 or above. And I'm sure from you'll be told in other sessions, so that's another thing that UVIC are very good at, is supporting students to get the right GCSE grades. Okay. So I just put this in because sometimes there's a little bit of confusion with pharmacology. There's actually quite important differences between pharmacy and pharmacology. Pharmacy degrees train you and license you to dispense medicines and work with the public, becoming a pharmacist. Whereas a pharmacology degree is something a bit more research focused. You're going to be investigating chemical effects, creating new remedies, perhaps working in the pharmaceutical industry, researching and manufacturing new medicines. There's a toxicology degree as well, similar to pharmacology, but that's going to focus on the toxic rather than the healing properties of venoms, poisons, and drugs. Hopefully, yep.
Thank you very much, Jo. I'll give you a minute to catch your breath there. That was excellent.
Thank you.
Can I just add as well, I think something else that we can offer at UVIC, which was going to help you to get into these careers, is that we have a dedicated work experience department, and they have a relationship with Barts and the Londons and many other medical organisations, and are able to find you placements that will help you to get onto these courses. Obviously, that's been quite difficult during the pandemic, and they've had to be looking at online versions of work experience, but they've worked very hard at that, and we can support students through applying for these courses with that work experience, which is essential. The other option is, if you look on later on the day, there is an honours session about our honours pathway, and there we can offer support with the UK CAT and the BMAT exams. So we're ready for that. Thank you very much.
Okay, great. So now I think Joe's gonna, we've got 15 minutes or so, and Joe's gonna give you a little bit of a taste of the kind of sort of things that you might learn about well, Joe, do you want to introduce it?
Okay, Karen?
Oh, sorry,
Sorry, I thought it was Karen.
Sorry, my apologies.
Okay, so as Laura was just saying, a taster about understanding and diagnosing mental health issues. So mental health is something that's obviously become, well, it's come to the fore, I think, during this pandemic. I'm not a biology teacher, I'm a chemist by profession, so I am going to hand over to Jo now and ask her to take you through the biology side of it. I'll come back and do the physics bit, if that's all right, Jo.
That's absolutely fine. Sorry, I was in the middle of answering someone's question there. That's why I was slightly distracted. I got into the Q&A there. Okay, fantastic. So mental health. What I would like people to understand is that there is a good biological reason underlying poor mental health, because we have treated people in the past with mental health issues so badly because we've just assumed they can pull themselves together. But we don't assume this with other disorders. You know, if you're diabetic, you take insulin. So if you've got a mental health disorder that requires medicine, it's really important to take that medicine and to understand that there's a biological reason why that needs to happen. So I've got a picture of the nervous system here, and that is to just remind us that the nervous system is composed of our brain and our spinal cord, which is our central nervous system, and the peripheral nervous system are all the nerves that branch out from the spinal cord. This underpins just many mental health issues are disorders of the nervous system. Okay. Can you put me onto the next slide, please?
Yep, sorry.
Brilliant. Okay. So right down at the sort of molecular level of the nervous system, we've got these little things called synapses. And synapses are how nerve cells talk to each other. Okay, so nerve cells talk to each other by releasing chemicals called neurotransmitters. And if we have too much or too little of those neurotransmitters, our nerve cells don't work, or they don't talk to each other properly. And that is the underlying basis of many mental health disorders, that our nerves are either talking to us too much or too little. Can you move me on to the next slide, please? Fantastic. Okay, so this is how a synapse works. So what happens is we've got arrows coming down at the top there, number 1, and that's our nerve impulse arriving at the synapse. So our neuron on the top is trying to talk to the nerve on the bottom. And then what we've got there labeled number 2, those are our vesicles containing our neurotransmitter. And what happens when the nerve impulse arrives is that stimulates those to move towards the space between the two neurons, which is known as the synaptic cleft. And our neurotransmitter gets released into the synaptic cleft and it diffuses across. That's number 3. And at number 4, it causes a nerve impulse in the postsynaptic neuron. Now then, if we've got too much neurotransmitter released at point 3, we're going to get too many impulses at number 4 in our postsynaptic neuron. That's talking too much. Okay. And if we have too little or none at all, if we don't have our neurotransmitter released at point 3, we're not going to get a nerve impulse in our postsynaptic neuron at number 4. So that means our nerve cells are not talking to each other enough. And this is the underlying basis of mental health issues. And this is something that doctors, pharmacists, pharmacologists, people that work in scientific research are trying to understand and trying to address and trying to help people rebalance these neurotransmitters. Okay, so serotonin. Okay, serotonin is a neurotransmitter, and that causes, if we don't have enough serotonin, that causes depression. We're all familiar with that. Our symptoms might be sadness, anxiety, hopelessness, loss of interest in fun activities. Perhaps we're recognizing some of these symptoms at the moment. Now, depression can be mild and it can be alleviated by getting out for a walk, seeing some friends, doing something that you really like. It's really important to look after our mental health in that way at the moment. But sometimes we've got a biological cause, we're just not producing enough serotonin, and that's when we need some help. Can we move on to dopamine? Oh, schizophrenia, yeah, brilliant. Okay, so schizophrenia. We've got another neurotransmitter there, dopamine. And when we have too much dopamine in the brain, we get the symptoms of schizophrenia. And we might be deluded, we might have hallucinations, be very agitated. Sometimes there's a very sort of a lack of emotional expression. Thinking is very disordered. We get inappropriate reactions, might be phobias. But we can also see lack of pleasure in activities that people normally enjoy. So our treatments for that is to try and block the binding of dopamine to the postsynaptic receptor sites. So basically we're blocking that dopamine, so we're not getting so much talking between the nerve cells. Brilliant. Okay, Karen, this is definitely your bit.
Karen, you're on mute.
Okay, so Joe's talked about what should we say, the biology and the chemistry behind mental health, and you can see how that would fit in, if you're interested in biology or chemistry, how that would fit in with being able to help people with mental health here. But you probably don't realize that physics plays a big part in medicine as well, particularly around imaging. And you do or you don't know, but you can actually scan people to see if they are depressed. You can actually run a scan. It's called a PET scan. That stands for positron emission tomography, which basically means making radiation and recording it. Okay, so what happens is somebody gets injected with a radioactive tracer. That tracer, if you're looking to try and diagnose depression, is designed to collect in the brain. Okay, so it will collect in the brain, and then by detecting the radiation, we can examine the brain and see if somebody's depressed. Could I have the next slide, please? Okay. Sorry, on the next one as well, sorry. Okay, so here's the sort of scans we get here. This picture shows you a PET scan of the brains. Now, the ones at the top are somebody who's suffering from depression and they haven't taken any drug at all, they've taken a placebo. And what we can see is the tracer is binding to the serotonin transporter, and we can see that that is highlighted in the brain there. Now, the serotonin transporter, as Joe was just talking about, if you're not depressed, then that will normally have serotonin in it and you wouldn't see anything going on. But because this person is depressed, they haven't got enough serotonin, the tracer molecule can bind to the serotonin transporter and it's showing up. The second two pictures at the bottom are a patient who's taken a drug, an SSRI, a specific serotonin reuptake inhibitor, that's going to help with their depression. And because that drug is in the serotonin transporter, stopping the serotonin being taken back up. You don't see as much there because your tracer molecule can no longer bind to the serotonin transporter because the drug is in there. Okay, could I have the next slide, please? And another one, please, sorry. I'll go one more. Thank you. Okay, so just to show this in a picture, there we are, what Jo was talking about as well. She was talking about the neuron and how the serotonin's going to be taken up into the neuron normally. I've got the serotonin transporter in green, and I'm showing you the tracer molecule as those 3 little red dots there. That's the name of the tracer. It's called carbon 11 DASB. So that carbon 11 is radioactive, and it's going to emit gamma radiation. Okay, so when this molecule is sitting on the serotonin transporter, it can be detected with a PET scan, and the radioactivity will show up in the brain, showing that there is no serotonin in the serotonin transporter, and hence the person has got a low serotonin levels. Diagram on the right is showing the action of the drug, the SSRI. This one is called citalopram, and it's shown as 3 little orange dots. So if you take an SSRI, it's going to sit on the serotonin transporter. It's going to stop the serotonin being taken back up, but it also stops the tracer molecule binding to the serotonin transporter because it binds more strongly. So again, if we run a PET scan and somebody's taken an SSRI, as I showed you in the previous diagram, we won't see any radiation from the tracer molecule because the serotonin transporter is now blocked by the SSRI. Okay, thank you very much.
Great, and that's it. Thanks very much. Sorry, I was just in the chat replying to a message here. Maybe we could just answer a couple of these live. I think we've got a minute to go. So I've got a question here about when's the best time to do an apprenticeship, dentistry related, after college or after university. So I was just trying to respond to this one.
Okay, should I take that one?
Karen, yeah, if you could take that one.
Okay, so there are different levels of apprenticeship. So it depends what level you want to go at. And you can actually do an apprenticeship at university. There are degree apprenticeships now. Now they come and go depending on what the government funding is, but you could take an apprenticeship at, it's called a level 4 apprenticeship at that point, isn't it, at university, which is involving you doing a degree at the same time. Or you can take a level 3 apprenticeship, which you can do after your A-levels, or you can take a level 2 apprenticeship, which you can do before. So it just depends what level you want to go in at. So the higher the apprenticeship, obviously, the higher the level you're going in at. So if you probably just want to be a dental technician, you can probably do a level 3 apprenticeship there. If you want to go on to do something more challenging, you probably want to look at a degree apprenticeship. So it depends what level you think you can go in at.
Thanks, Karen. Thank you. And I'll just squeeze in, we've got another final question here. We've had lots of really good questions coming in on the Q&A chat, so thank you guys for that. So I've just had another one, right, the final 2, and then we have to end the session. So so this is relating to the first question, what to study as a third A-level if they want to pursue dentistry. So I guess if in combination with biology and chemistry, which would be essential, if I chose a language, for example, French, would that decrease my chances of getting into medical school? As I've heard that many students that go to medical school have done things like psychology, maths or physics. So just advice on that third A-level.
Okay, so it's going to depend on the provider, I think, isn't it, Jo? So it's going to depend on exactly what their requirements are. And different providers have got different opinions about this. So I would absolutely advise that you get onto that UCAS website and have a look at the requirements there. Some people would be quite happy to take you with an A-level in French, some people won't. So it's just going to depend on the provider.
Okay, and then final one, what percentage of medic students successfully end up in a medical career from UVIC? Okay,
so medicine is extremely challenging to get into, but I mean, I've got half a dozen students in the last few years into medicine. In terms of medical careers, though, we do very well indeed. Okay, we're sending a lot of people into our top 3 destinations. We're going to be radiography, biomedical science, and nursing. Okay, and we can add another half a dozen medicine students onto that.
Great, thanks, Karen. And yeah, and just response. So we've done an interview with one of our students who's currently studying medicine at university. So we've got an interview of that's going to be going up on the Open Day website over the next couple of weeks. So keep an eye out for that, because that's going to be a really interesting session if you're interested in studying medicine. So we've come to the end of this session. So I just want to say thank you everyone for coming. I hope that this has been interesting and useful for you and inspiring to help you get thinking about your careers and different combinations of courses. And I hope that you found this useful. Again, if you want to find out any more information in depth about specific courses, please watch the videos on our Open Day page on the website. And if you have got any more questions, that you can email us using the email that you would have received. There's an email address attached for registering for this event. You can email us there, or you can email us at advice@uvic.ac.uk. That goes to our advice and recruitment team. So they're kind of the experts on entry requirements and what you need to study for what and the application process. So if you can contact them on that. And then just to say, applications are now open for September 2021. So if you'd like to apply, please visit our website to complete an online application. So that's it from us. Thank you everyone for attending this session, and we hope to see you soon. Okay, thanks. Bye.